Thanks for listening. I want to make my point very quickly, and that is, I have the conclusive and absolute solution for the failed healthcare fiasco in this country. Additionally, my plans fix the financial flaws within the healthcare system and actually trickle down to other realms of social and economic categories. And it even helps to correct other issues forcing damage to this once great nation. There have been many proposed solutions, but please do not make a mistake and do not disregard this one. This is the absolute solution. I am not selling anything. I am not promoting anything. I just want solution. I am not proposing to fix the failed Obamacare solution, and this is not a modification or insurance reform. In fact, it is financially beneficial to the insurance industry, what I will promote. And it saves Medicare and Medicaid funding, while at the same time appealing to physicians, hospitals, clinics, and all patients. This seems an impossible fantasy, but the system works. And it is unbelievably simple to initiate, and it does not need to even overhaul the entire insurance industry, but it in fact saves the insurance industry. It is not really a plan for starting over, but to institute a few key regulations into the system, it essentially does better than starting over, and it is much easier. It keeps physicians and hospitals and clinics all being paid the same or more, while allowing employers and patients to pay less for their insurance coverage and less for their medical care. And therefore, business saves money, and it allows the insurance industry to actually save money and show more profit and trickle down to make employers pay less and patients insured pay less for their insurance coverage. This would unquestionably save the nation and be welcomed and accepted by most, if not all, physicians, hospital, clinics, providers, which I have already beta tested many of these ideas and received only beyond positive responses, and also tested it with most patients, which is basically all citizens of this nation. Interestingly, when I promote this and present it to other physicians, clinics, and providers, the comment I get is, wow, that sounds great, but it'll never happen. And I ask, why will it never happen? And there is one common answer unifying everyone's answer, and that is, well, the government will never allow it. We cannot fail by disallowing this solution because the government will not allow it. The government will desire it if they hear the presentation. And this is not just an arbitrary solution. My solution is validated by my life experience. I am a multiple board certified physician in private practice and hospital clinic setting. Therefore, in my private practice, I am also a small business owner. I have made business presentations already in multiple forum settings and in our state legislative building, in front of attorney generals, in front of other labor department attorneys, not on this specific topic, but I provide this information to just give my background, that I am not foreign to such ideas and presentations to government and what is necessary to run and operate a business that works. So I consider myself a little different than the average employed physician and more involved with the intricate failure of this nation's financial and insurance and Medicare and Medicaid system than the average business owner. Unfortunately, MBAs in healthcare industry And most government health care reform advisors really do not understand all of the true intricacies and problems and do not understand how to correct it. They may be able to correct it on paper, they may be able to correct it in theory, but my paper correction and theoretical corrections are validated by testing this information and elements on everyday patient situations. Therefore, I must say that my experience as a physician working in the trenches come and promote recommendations that are superior to any government advisors relative to where exactly lies the problems and how to fix them. The solution itself is based in a very simple methodology. Any profitable business needs to keep a watch on their bottom line to increase the net profit. Either a business can raise the cost of their product or decrease the overhead or production costs, which is part of the overhead. Any and all successful businesses operate in this exact manner except the healthcare industry. Instead, the healthcare industry simply looks at just fortifying insurance and strengthening coverage to cover whatever costs exist. But these costs are not created by doctors or providers. These costs, and I should say these excessive costs, are industry driven, and they are elevated because of huge overhead factors, many of which are not even necessary. But they may seem necessary on the outside until they are exposed and truly understand by those of you not exactly on the inside dealing with them on a daily basis. And that is the key to this overhaul. It is time for the business of the healthcare industry to function similarly to the rest of all successful business, and then we will have a solution. I have a multiple detailed solution for lowering the costs of healthcare by removing excessive waste and unnecessary costs that raise the overhead of healthcare. My system does not cut corners. My system does not ruin healthcare. In fact, my system lowers the cost of healthcare while at the same time allowing the providers in the clinics to provide better healthcare and better patient care. My detailed plan is too lengthy to cover in this brief letter that I have sent in to the government. And since it has not really been responded to, now I have created this into this recording you are listening. I will be so excited, and you will be too once you hear it, to listen to the detailed rendition of what I can do with my simple method. I can lower the cost of healthcare at the providers, at the physicians. I can also lower the cost of retail medication at the pharmacies, while even bringing increased profit to the large pharmaceutical companies and the insurance carriers. I can create a system in which a regular medical office visit could cost as little as $30, while at the same time, believe it or not, appealing to the medical clinic provider and physician who will actually make a considerable income and profit from even lower fees being paid because their overhead has been decreased. They will in turn be able to see the number of patients per hour they wish instead of being hoarded in like cattle. And this will also increase the safety of healthcare, where physicians will not be rushed beyond what they are comfortable to make ends meet and the bottom line. And in result, better healthcare will come And unfortunately, certain elements will not be missed because examinations will be able to be as thorough as the physician would like to provide. Instead of time-cutting tactics that are necessary to do now with the current system. My system includes corrections for the intricacies of many aspects of the financially ruined healthcare system, which also deals with Medicare and Medicaid coverage, welfare system, food stamps, Social Security, disability, workers' compensation, etc., etc. In addition, of course, to the private sector health insurance. This is not just a social assistance correction, but the social assistance correction is included in my plans. So it is encompassing private sector and social system corrections. It truly pains me that my plan is so simple and yet the country is blind to see it. And I say blind because when I present these ideas to other physicians, and when I present these ideas to other patients, people's eyes open and are astounded at how simple the solutions are. And for several years now, I have been refining my plans and presenting my ideas to other physicians and business people and many patients. And anyone who has been presented this solution agrees that it would benefit so many people and be accepted by the vast majority of medical professionals, clinics, hospitals, etc. It is such a very simple angle to solve this healthcare fiasco. And the government officials have not even mentioned this in any notable proposals ever. Because healthcare has never been managed like a business. Here's a question for you. What is better? To work on how much a person has to pay for insurance coverage to cover a $200 medical bill? Or to work on how to lower that $200 medical bill in the first place to $50? So the person would just possibly even rather pay out of pocket and not have to deal with insurance if they did not have such, because there would be such a lower cost. But at the same time, that lowering did not take any profit away from the providers or physicians. All it did is skim away the useless extra expenditure for nonsense overhead that I can demonstrate why it is not needed. The current system is frankly putrid. I have the detailed recipe as a stepwise approach without overhauling the whole system, but by just instituting 15 regulatory legislative rules, simple rules that if they are interjected into the healthcare system as law, and as long as they are followed, then it works towards this correction. And anyone who would like to hear these laws and their explanations of the regulations, I am beyond willing and would be greatly pleased to present them. This is the correction we need. My recipe allows excellent health care to be provided while reducing the wasted unnecessary costs and bringing down overhead and thereby lowering the cost of providing health care in the first place. And my detailed cost-cutting plan works great and does not lose any attention to the patient's needs, and in some cases even provides better attention. This is a solution, and it is a simple solution based in logic and business, and it is so easy to initiate. In fact, 50% of my solution could be initiated simply within a 30-day process, and nobody would even know the difference other than seeing the benefit. It would be just easy to initiate instituting these regulations. The fallout would be more of a terrific result. And it would happen on its own volition once these regulations were initiated. What if you could have the same or better healthcare coverage, pay less than you pay now, and go to a physician or provider who is actually being paid the same or more than they are getting now? And when that physician or provider sends you to the pharmacy, you actually pay less, and your insurance pays less for the prescription medication, and your insurance premiums go down because you don't have to pay, and the insurance doesn't have to pay so much for that medication. And all this is while the providers and physicians are paid the same, if not more, and the large pharmaceutical companies also are paid the same as they are for their current medications. How can that possibly be? Remember, it all relates to the overhead. And this system is a permanent fix. Everything else and anything else has been and would be a temporary Band-Aid. Let's not Band-Aid anymore. Let's fix. Thank you for your time and interest of listening to my words. And realize that I have not included the detailed solution with this recording because it truly needs to be understood and not just listed. But I am so excited and would be pleased to present it. And I will provide a link to where you can view it. Thank you.